Appraisal Guidance for Locum Doctors Part 1. The regular doctors working in hospital and general practice get a good steer to process and paperwork for appraisal and revalidation from the responsible officer. The locum doctors somewhat lack in the initiative for appraisal and succinct guidance. The working pattern, aims and requirement of locum doctors are also slightly different, and not all aspects are fully relevant or demonstrable. It is, however, important to focus and do as much as possible for demonstrating good medical practice. Some locum doctors never had appraisal and are not clear why they need to do it. A medical appraisal is a process of facilitated self-review supported by information gathered from the full scope of a doctor's work. Annual appraisal is necessary for revalidation and GMC license to practice. What is the aim of appraisal? To demonstrate that you are meeting GMC professional standards of good medical practice in your everyday practice. This needs to be demonstrated by collecting supporting information for good patient care, communication, team working, leadership, clinical audit, etc. There are 4 areas to focus in appraisal, and these are outlined in MAG form. 1. Knowledge, skills and performance. 2. Safety and quality. 3. Communication, partnership and teamwork. 4. Maintaining trust. You will need to maintain a portfolio of supporting information to demonstrate that you are continuing to meet the attributes set out by the GMC. The portfolio should preferably be electronic, and you must attach documents or information to MAG form or send separately to the appraiser or appraising agency. Your appraiser will therefore want to know what the supporting information says about your practice and how you intend to develop or modify your practice as a result of that reflection. You as a doctor must reflect on your practice and your approach to medicine. Reflect on the supporting information you have gathered and what that information demonstrates about your practice. Identify areas of practice where you could make improvements or undertake further development. Demonstrate that you are up to date and fit to practice. You must remember that an annual appraisal and supporting evidence are key to demonstrating your fitness to practice whatever is your branch of practice. A medical appraisal is a key opportunity to think and focus on your professional development needs. As a locum doctor, you can use medical appraisal to plan your career, what you want to do in short and long term. You can focus on setting goals for next 12 months for your professional development. Appraisal is opportunity to discuss and identify learning needs. Remember that regular appraisal is essential for revalidation and licensing by GMC. 3 basic elements that help appraisal discussion and a satisfactory appraisal are: multisource 360-degree feedback from colleagues and patient feedback, good record of CPD and learning from it, case review of patients from where you learned, that is, where things have gone well or not so well, particularly what could be done and how it changed your practice. Ideally, you should have 250 CPD in 5 years. More important is to record how you will use this learning and if this learning changed your thinking and practice. Each 1 hour of reading and learning counts as 1 CPD, and there are several online courses in addition to formal courses that count for CPD. You should keep a record of your learning and reflection from personal reading. Multi-source feedback needs to be done in accordance with GMC guidance, and it needs to be a validated tool. You can get help from your locum agency or appraisal agency to get more details. It can be difficult if you are doing short-term locums to do a multi-source feedback, as it is difficult for colleagues to know you and give a valid feedback. It is therefore be worth thinking of doing at least 1 long-term locum to get MSF done. GMC recommends 1 MSF in 5 years. However, it might be better to do it every 2 to 3 years for locums due to lack of continuous supervision. You can choose colleagues to whom you give feedback form for getting honest opinion. Patient feedback form about you can be given by yourself or a nurse or someone else. However, patients shouldn't be asked to complete it in your presence. Ideally, it should be collected by someone else. The colleague feedback from doctors, nurses, managers, etc., as well as patient feedback then should be sent back to the agency. It is good to keep a record of all complaints and compliments and your reflections from these. Good practice need to be promoted, and you need to reflect how you are going to improve on your practice that is not helpful. You need to write case review with patients where things haven't gone right. It is usually an anonymous reflective summary record of what happened, how it happened, and what could have been done to get a different outcome. It is important that you think, if you encounter a similar case, how will you think differently in future and how that learning can be applied to other cases in your practice. Many of us don't think when things go very well and why did that happen. It might be good to keep a record of 1 or 2 such cases. Due to limitations of locum work, involvement in clinical audit may be difficult. However, 5 to 10 such case reviews per year will help you demonstrating quality improvement of your practice. Remember that patient feedback is very important to demonstrate you maintain patient trust and quality of care. Your colleagues, however, will give independent professional opinion of your medical practice. You can make the appraisal more meaningful by putting more efforts into it for your personal development and reviewing your progress against these goals on an annual basis.